Hi, my name is Michelle Stewart and I'm the CEO of PanKind, Pancreatic Cancer Australia. The global burden of pancreatic cancer has more than doubled in recent decades. It currently has one of the lowest survival rates of all the major cancer types. The average time from diagnosis to death is just 5 months. 5-year survival in Australia sits at around 13%, only marginally better than the global average of 10%. This is an intractable problem. Survival rates have barely shifted in decades and it's clear we need a new approach. PanKind is the only organisation in Australia solely dedicated to improving outcomes for those affected by this disease. And through research, advocacy, awareness and support, we're working to triple survival rates by 2030 and to improve quality of life at every step. PanKind was founded by Avner Namani and his wife Caroline Kelly. Tragically, Avner passed away after just 18 months, but his legacy lives on. The foundation began with a simple, powerful idea that no one facing pancreatic cancer should have to face it alone, and that together we can demand better and create change. Over the last couple of years, we've grown into a national leader, funding cutting-edge research, championing earlier detection, and pushing for a fairer, more responsive system. As CEO, I'm proud to lead a team driven by purpose and grounded in evidence. But we're also led by compassion and by what people tell us they need. Because pancreatic cancer often carries a poor prognosis, it's not unusual for people to search for alternatives, wondering if something more effective is available overseas or through unorthodox treatments. We've seen people travel across the world in search of hope at enormous emotional and financial cost, often while incredibly unwell. And while their courage is inspiring, we know that this space is filled with complexity, misinformation and risk. As an advocacy organisation, it's our responsibility to understand what is out there and, just as importantly, to be honest about what isn't. This is what led me to join the LeadersLink Program. My capstone goal was to create a system that supports people living with pancreatic cancer to explore alternatives to standard care, including clinical trials, and to navigate the uncertainty that comes with making these deeply personal decisions. To begin, I needed to understand the landscape. I read the literature, attended global conferences, I spoke to patient groups in the World Pancreatic Cancer Coalition, and I engaged directly with patients and their families. I listened to their experiences and looked for glimmers of hope. I also reviewed countless patient forums. I did this research so that I could help those who were trying to do this themselves when they've just received a traumatic diagnosis. What I found was sobering. There isn't a hidden cure out there, neither conventional nor alternative. The idea that something miraculous is just out of reach is a myth, and a dangerous one. We took this seriously, and as a reputable patient organisation, we're committed to being evidence-based, but also empathetic to the urgency that people feel. We didn't find anything promising in the alternative space, and that allowed us to focus on clinical trials with a clear conscience and an open mind. It also meant that I could return to our community and say truthfully that I've looked into this without bias. That transparency matters, especially for those who feel less confident about the medical system. But clinical trials are not easy to navigate. They're often inaccessible, complex, and hard to understand, especially for people from diverse or rural backgrounds. We wanted to fix that, and we hired a pancreatic cancer clinical nurse to personally support those people who need understanding and need help understanding their options. We've partnered with TrialScreen, which is a platform that helps people find relevant trials more easily and makes direct referrals to trial sites, reducing the burden of multiple layers of bureaucracy. We've also worked on education, creating resources to encourage patients to ask about trials at diagnosis and build awareness that trials are legitimate options, not just a last resort. So what's next? There's much hope in pancreatic cancer and the future has never looked so bright. There are a number of new treatments that are finally reaching patients after many years of research. We are focused on accelerating these advances to patients as quickly as possible. Our goal is that one day pancreatic cancer may be managed as a chronic disease and no longer will a diagnosis be filled with terror. I've followed FasterCures for years, and when I saw the opportunity to learn from others who've achieved what we're hoping to gain new skills and refine my impact, I knew I had to apply. The program has helped me sharpen my thinking, but more than that, it's given me space to pause and reflect. This is something very rare in this line of work. To future participants, I'd say this. There are many people who have learnings in other diseases that can be applied across therapeutic areas. People are so generous with their time and information, and this is where I've found the most value. We are now piloting our patient navigation system, refining the framework, gathering feedback, and continuing to iterate. With input from clinicians, researchers, policymakers, we're building something practical, compassionate, and deeply human. And finally, representing the patient community is an honour, and with that comes responsibility. We must speak clearly, ask the hard questions, push for answers that reflect what it's like to live with this disease and what it takes to live beyond it. We need to keep going until the systems we've built match the urgency of the people we serve.